So we're looking at a type 2 acromion here. The first thing I want to do is clear off the soft tissues starting from the lateral side of the acromion working to the medial side. We're currently looking at the acromion from the posterior portal. The lateral subacromial portal that I utilize is an 8mm cannula, and that's so that we can provide a large burr through the cannula, which you'll see coming up in the next step. An acromioplasty can be performed efficiently if it's done systematically, moving lateral to medial and then front to back. And so once we establish what the edges of the bone are, then we can move to the burr and try and create a type 1 acromion. Now I would estimate that the thickness of this anterolateral acromial edge is approximately 8mm. And so this burr here has a 7mm diameter, so it's placed through an 8mm cannula. In order to resect the appropriate amount of bone, I focus on first raising the anterior edge of the acromion so that it meets the posterior edge where there is no acromial resection. Essentially, we're trying to create a type 1 acromion by flattening out the anterior portion of the acromion by resecting the appropriate amount of bone. And so if I think that it's an 8 or 9mm resection, the burr gives me a measuring guide. So if you look here, we've raised the anterolateral edge up to the approximately 7 or 8mm based on the thickness compared to the burr. Once I have that established, then I just move symptomatically from lateral to medial, and using the very tip of the burr on the most anterior edge of the acromion, I can continue to systematically move from lateral to medial and then essentially from anterior to posterior. And by doing so, I ensure that I'm not taking too much bone in the central portion of the acromion or scooping out any of the bone from the central portion of the acromion. This up-close view gives me the ability to clear out the bone dust and create and prevent bleeding and give me a nice smooth finish. So this is essentially the finished product, which is a type 1 acromion, about an 8mm bone resection. And it was done efficiently and appropriately. Thanks for watching.